Welcome to our course on cold stress. What is cold stress? Cold stress is the loss of body heat to the environment. During this course, you will learn about the causes of cold stress, such as low temperature, wind, and wetness, and how they have a combined effect on the body to create cold stress, injuries, and illness. This information is important because cold-related disorders, such as hypothermia and frostbite, can kill or seriously injure workers. Employers and employees should be aware of cold stress hazards, cold-related disorders, and how to prevent and treat them. This course will give you the tools and information you need to recognize extreme cold, identify the sources of heat loss, explain what may happen when you are exposed to cold, identify symptoms and treatments for hypothermia, frostbite, and trench foot, identify factors that contribute to cold stress, and use precautionary guidelines to prevent cold stress. The definition of extreme cold depends on where you live and work. Where winter weather is uncommon, near freezing temperatures are considered extreme cold, while those same temperatures may not be called extreme in snowy regions. When temperatures drop decidedly below normal, and as wind speed increases, heat can leave your body more rapidly. This is a dangerous situation that can lead to health issues and emergencies. Before we learn about the sources of heat loss, let's take a moment to see what you've learned so far. Click Next to continue. True or false? Temperatures near freezing would be considered extreme cold in a city like Miami, Florida. There are several potential sources of heat loss. Use the arrows to learn what they are. Bill is working outside on a very cold day. He's wearing a parka and insulated gloves while moving boxes out of a truck and into a loading bay. As a result, he's working up quite a sweat. Bill's situation could become dangerous because of what? When you are exposed to extreme cold, your body tries to conserve heat by shifting blood from your extremities to major internal organs or your core. Exposed skin and extremities cool faster and increase your risk for frostbite or hypothermia, which we'll discuss further later. When you are exposed to extreme cold, you may be unaware of your condition getting worse. Watch out for these symptoms in yourself. Decreased mental alertness, such as difficulty focusing on tasks, loss of mobility and dexterity, feeling extremely tired, feeling the effects of the cold more quickly. You may also find yourself rushing to complete a job to get out of the cold. This increases the potential for mistakes, which can lead to injuries. In addition to monitoring your own condition, be on the lookout for the following symptoms in others. People suffering from extreme cold may slur words, drop tools or equipment, trip, or have difficulty walking or standing, become irritable or angry, lose dexterity or coordination. The tools people work with can become cold too. Working with cold equipment can lead to a slowing of circulation and increased risk for soft tissue injuries. People with existing injuries, such as Raynaud's syndrome, which is caused from contact with vibrating tools, will likely experience more frequent painful symptoms in the cold. To prevent these symptoms, use insulated tools. Which of the following is a consequence of exposure to cold? Hypothermia is a medical emergency. It can be fatal if it is not caught and treated quickly. Hypothermia occurs when someone has an abnormally low body temperature at or below 95 degrees Fahrenheit. The low body temperature affects the brain. People experiencing hypothermia may find that they are unable to move well or think clearly. They may also feel disoriented. Be aware that hypothermia is most likely in very cold temperatures, but can occur even at cool temperatures above 40 degrees Fahrenheit if someone becomes chilled from rain, sweat, or submersion in water. To guard against worsening effects of hypothermia, do not work alone. Work where others can see you and you can see them. Watch your coworkers for these symptoms. Intense shivering. It may seem simple, but do not ignore it. It is one of the first signs that your body is losing heat. Exhaustion or drowsiness, and/or confusion, memory loss, slurred speech, euphoria, or somebody collapsing. If you suspect someone is experiencing hypothermia, get medical attention immediately. If medical attention is not available, or while you are waiting, begin trying to warm the person. The best ways to warm hypothermic individuals are to bring them to a warm room or shelter. Remove any wet clothing. Warm the center of the body first, chest, neck, head, groin, armpits, using skin-to-skin contact under loose, dry layers of blankets, clothing, towels, sheets, or hot packs or warm bottles. Provide warm beverages only if the person is conscious. Do not immerse hypothermic individuals in warm or hot water. It may stop a victim's heart. A person with severe hypothermia may be unconscious and may not seem to have a pulse or to be breathing. In this case, handle the victim gently and get emergency assistance immediately. In some cases, hypothermia victims who appear to be dead can be successfully resuscitated through CPR. Frostbite occurs when skin tissue freezes. The nose, ears, cheeks, chin, and fingers or toes are most susceptible. Victims are often unaware of their condition until someone else points it out, because frozen tissue is numb. Therefore, it's important that you learn to recognize the signs and symptoms of frostbite. They are an initial burning sensation, coldness, numbness, or tingling, white or grayish-yellow skin, and/or skin that feels unusually firm or waxy. Frostbite can leave permanent irreversible damage, such as long-term increased sensitivity to cold, pain in the affected area whenever you are exposed to cold, or even damage that requires amputation. To prevent frostbite, get out of the cold at first signs of redness or pain. If you are experiencing signs of frostbite, get medical attention as soon as possible. If medical attention is not available, or while you are waiting, begin the warming process. Get into a warm room as soon as possible. Unless absolutely necessary, do not walk on frostbitten feet or toes. This increases the damage. Immerse the affected area in warm, not hot, water. The temperature should be comfortable to the touch for unaffected parts of the body. Warm the affected area using body heat. For example, the heat of an armpit can be used to warm frostbitten fingers. Do not rub the frostbitten area with snow or massage it at all. This can cause more damage. Don't use a heating pad, heat lamp, or the heat of a stove, fireplace, or radiator for warming. Affected areas are numb and can easily burn. Trench foot occurs when you combine cold with water exposure. The signs and symptoms of trench foot include severe pain, tingling, or itching in feet and legs, swelling, blisters, or reduced touch sensation. To prevent trench foot, keep your shoes and socks dry. If trench foot occurs, treat it in the same manner as frostbite. Your coworker Sam has been working out in the cold all day. You notice he is shivering violently and seems confused. What may Sam have? What should you do to treat frostbite? So far, you've learned about how we lose heat, what may happen when we're exposed to extreme cold, and how to treat some cold-related maladies. Now, let's talk about factors that can contribute to or accelerate cold stress. Cold stress is more likely when weather first turns cold, or there is a sudden weather change and the body hasn't yet adjusted to it. Other factors that may enhance the effects of cold are pre-existing conditions such as arthritis, connective tissue disease, heart conditions, or high blood pressure. If you have any of these conditions, you'll need to be extra diligent about preventing cold stress. Remember that cold weather puts an extra strain on your heart. Your body is already working hard to stay warm. Any additional effort or exertion when you're working results in an added strain. Some other factors that may impact how cold affects you are your age and health, the activity you're doing, the temperature, and the wind chill. The wind chill index is the temperature your body feels when air temperature is combined with wind speed. So, while it may only be at freezing outside, it may feel as if it is well below. Remember convection heat loss. The faster the wind, the faster heat is carried away from the body and the faster it cools. When it is extremely cold, there are other issues to consider than just the weather. In extreme cold, be aware that safety glasses can fog up. Snow, rain, or sleet may be present and can create hazardous walking or working surfaces conducive to slips, trips, and falls. you or your company should have a plan for clearing ice and snow before work starts. True or false? Cold weather So far, you've learned about the causes and consequences of cold stress, but how can you prevent it? Let's focus on some basic tips you can employ to prevent or reduce the effects of cold stress. Work practice controls, clothing, and general tips. Use the following work practices to minimize cold stress. If you are working outside, create a wind shelter if possible. When you create a shelter, use thick plastic to block the wind, rain, and snow. Be careful when using portable heaters in these shelters. Avoid electrical and fire hazards. Limit your exposure to the cold and gradually build up the amount of time you spend in the cold to help your body adjust. Set up work-rest cycles. If possible, schedule work at warmer times or move work to warm areas. Recognize environmental conditions that lead to cold stress, as we've discussed previously. You may also want to take frequent breaks in a warm area. Employers should provide warming shelters when temperatures drop below 19 degrees Fahrenheit. They may also provide general or spot heating areas, including hand warming. Reduce conductive heat transfer by avoiding metal chairs or uninsulated tools. Stay hydrated by drinking warm, sweet drinks or broths. Increase your food energy intake. Remember that the weight of extra clothing and need for extra energy to keep your body warm means you expend more heat and require more energy from food than usual. Your clothes are what stand between you and the cold. Make sure they provide the best protection by using these simple guidelines. Keep your clothes dry. Remember that wet clothing chills the body rapidly. Dressing in layers not only keeps you warmer, but also allows you to remove extra layers when you start to feel too warm. Excess perspiration will increase heat loss, so layer clothing and socks. Inner layer. Use materials like wool, silk, or polypropylene that draw moisture away and tend to hold more body heat than cotton. Middle layer. Use well-insulated material or wool that provides warmth without weight. Outer layer. Wear material that protects against water and wind. Wear a hat to prevent heat loss through your head. Protect your hands by wearing insulated gloves. When you know you will be working in the cold, consider the following general precautions. Limit or stop use of nicotine, caffeine, or alcohol. All of these substances hinder your body's response to cold and can impair judgment. Monitor how your prescription and over-the-counter medications affect your body's response to cold. If you have concerns or questions, talk to your doctor or a pharmacist. Remember, space heaters and wood or coal-burning fires increase the risk for fires and carbon monoxide poisoning. Be aware and prepared. What type of material should you wear for your outer layer of clothing? Congratulations, you've reached the end of the course. During this course, you learned how to recognize extreme cold, identify the sources of heat loss, explain what may happen when you are exposed to cold, identify symptoms and treatments for hypothermia, frostbite, and trench foot, identify factors that contribute to cold stress, and use precautionary guidelines to prevent cold stress. As you go about work, we hope this knowledge will help you combat cold stress and stay healthy and productive.